This week, we'll be discussing how you go about the process of creating goals with your client. And in this lecture, we'll be talking about the purposes of your treatment goals. Now, last week, we talked about assessment. And assessment gives you an idea of where your client is at the start of therapy. It establishes a baseline. And then your goals tell you where you're going to go from there, how you will proceed from that baseline. So treatment goals represent the destination or the end point of therapy. It's your vision with the client of where they want to be at the end of therapy. The goals are determined by the client, but the helper and the client collaborate to define, clarify, and describe their goals. And remember that this must be done within the context of a good therapeutic relationship. Everything you do in therapy will be based upon the strength of that relationship. So again, with your treatment goals, shared decision making must occur. You must collaborate with the client to make all decisions about their goals. Movement is much more likely when the traveler can see for himself the destination in the distance or see the endpoint on the map. So you really want the client to be able to envision where they will be at the end of therapy. So what are the purposes of your treatment goals? Again, they provide direction. They sort of serve as signposts to keep the work of therapy on track so you can see where you're going. They also provide focus. So it helps you and your client focus attention on goal-relevant activities and away from goal-irrelevant activities. So in choosing your interventions and choosing your homework assignments or any of the work that goes on within therapy, you want to make sure that those tasks are aimed at moving you toward your goal. And goals foster expectation and hope for improvement. So again, it helps your client visualize where they'll be at the end of therapy and gives them hope that change can occur. Goals will help determine helper qualification. So when you have clear goals, it will let you as a helper know whether or not you have the training and experience and qualification to help your client meet that goal. Your goals will justify recommended services. So you can justify to yourself, to your client, and to anybody who might be reimbursing you for services why you are doing certain things, why you're using certain interventions, because they will be helping you meet this particular goal. And then your goals help you evaluate outcomes. So if you have clear goals, you can determine through assessment and evaluation how you are progressing toward those goals.